Hi, everyone. I'm Sania Ashraf, and I'm here with my colleague, Jenny Kwang, from the Center for Social Norms and Behavioral Dynamics at the University of Pennsylvania. We're going to talk about the risk perception, stress, and sanitation practices in the early phases of COVID-19 pandemic in peri-urban communities in Tamil Nadu in India. Now, India is in the headlines right now with a new wave of COVID-19, and we think some of our findings might still be relevant in thinking about preventative efforts. In March of last year, India went through one of the largest national lockdowns in the world, restricting the movement of 1.3 billion people. This was strictly enforced at the community level, where households were not allowed to move around and essentials were delivered near households. To understand the situation better, we utilized our team from another study, which was looking at sanitation practices, to conduct a rapid phone survey. We reached 2,044 respondents from 26 communities for a phone survey between May 20th to 25th. In Tamil Nadu at this point, the number of cases were relatively low, with around 150 reported cases in those districts and a few deaths. Trained field workers asked them about people's awareness of COVID-19 symptoms, risk perceptions, and changes in behaviors and the stress levels during the lockdown. We also asked them whether they had access to a toilet, whether they or a family member had to leave the house to defecate in the open in the past week, and whether specific practices had changed. I'll turn it over to Ginny to go over the study she wrote.
Thanks, Sania. During the early phase of COVID-19 pandemic, we found that a majority of the respondents in peri-urban communities reported perceiving no or a low level of risk of personally contracting coronavirus. We also find a high prevalence of fear related to both the health and economic impact of the pandemic. Although residents were well aware of the common symptoms of COVID-19, only a small proportion mentioned the asymptomatic transmission. Aside from the change in behaviors in response to the COVID-19 pandemic, we found that the majority of respondents reported experiencing increased stress about finance and about the lockdown. This might potentially be due to the fact that a large proportion of the household in urban community area are involved in informal labor and micro, small, and medium enterprises, which are particularly vulnerable to the distress caused by the lockdown. These findings suggest the government and community-based program should emphasize the asymptomatic transmission features of coronavirus through various communication channels. We also suggest an expansion of social protection program, including public distribution system, cash transfers, and urban public works programs to mitigate the risk of financial stress. And finally, we suggest community-based participation programs to incorporate stress reduction and coping strategies to address and improve residents' mental health and well-being. These programs could include mutually checking on neighbors' well-being, using social media to reach network members and receive community support, and coping programs to ensure inclusive participation. I'll hand over to Sania.
Thanks, Ginny. So for sanitation reasons, for some context, India had a decade-long national program to improve access to improved sanitation. We found in our study that sanitation conditions in peri-urban communities that we were looking at were still poor. Almost a third lacked access to any toilet facilities, and most of them left the house to use the toilet during the lockdown to defecate in the open. About 11% of our respondents reported that they used a public toilet, and majority continued to use them during the lockdown, meaning they did not change their behavior as a response to the pandemic. During this time, what we saw that the government did not have a formal COVID-19 control strategy focused on toilet usage or public or community toilets. Our results highlight that shared toilets need rigid disinfection protocols and behavioral precautions to reduce fomite transmission. It also shed light to the health risks and the burden faced by those still without access to improved sanitation. We have wrote up these papers and they have been published. We encourage you to take a look at them. And for discussion and any questions, here are our email addresses, and we're happy to talk more there. Thank you so much.